Hello, my name is Heather Shepard, and today I am going to be reviewing Sentara Norfolk General's professional practice model. An overview of Sentara Norfolk General itself. We are a level 1 trauma center with 525 beds on the east coast of Virginia. Sentara itself has 12 hospitals on the coast of Virginia and North Carolina, but specifically at Norfolk General, we have the Nightingale, which is just a emergency flight vehicle that helps get traumas to our center, especially if they're outside of a certain window of time. We just want to take action and get those people there to us to provide the care. We're a magnet level care, so we uphold the highest standards. In addition to the hospital itself, we have an attachment that is the heart hospital. So cardiothoracic surgeries are huge there. Vascular, we've got the stroke center. Neuroscience is huge. Oncology, so many things, including a neonatal intensive care unit. So as far as our professional practice model, relationships are huge. Making the first impression on the patient and their family to make them feel comfortable with us, create a therapeutic relationship with them, is only going to help their outcome. And this includes the whole team. So interdisciplinary teams, we all want to have a great relationship together as a team and with the patient. And this is just going to help create a comfortable environment and help transition the patients if they are downgraded, upgraded, going to imaging. All of this is brand new to them for the most part, and most of them are in a foreign place. And just making them as comfortable as possible is just going to help improve their satisfaction with us. This is something that I pulled off of Sentara.com. This is just a visual representation of the professional practice model, which I think is really great because this is a Parthenon, which represents just knowledge, strength, and power in ancient Greece. And it just kind of is a visual of our goals and just really embodies critical thinking and improvement and just being as good as we can as far as health of our patients. The foundation of that Parthenon is Dorothea Orum's self-care theory and a culture of safety and accountability. I feel like these things really do go together. When you think about Dorothea Orum, you know, it's really the patient taking accountability for their health, us taking accountability of educating the patient and helping them get to that state where they can really take care of themselves. And we also always want to involve the patients and their families, empower them to just take a hold of their health, take charge, and be as involved as possible. So the nursing scope of practice, like I said, just guiding the patient towards meeting their goals, taking an active role in their care is just going to improve their outcome and improve their quality of life later, focusing on therapy, physical therapy, occupational therapy are two huge things that we deal with, which is interdisciplinary team, and just making sure that these patients can truly take care of themselves when they leave. This table is something that I pulled off of Sentara.com, and I just really liked the way that it took our nursing process and tied it in with Orum's theory. So we all know assessment, intervention, implementation, evaluation. That's just something that's just driven into our heads as nurses, but this is a really good way to associate it with the theory itself, and it just makes sense. So for assessment, determining why we're doing the things we're doing, making judgments on what the patient needs. For the intervention, just making a plan for the patient. Now we've done our assessment, we've made our judgment. What's our plan moving forward? And then implementation is obviously putting that plan in place and providing the care. Evaluation, how did it go? You know, did our interventions do what they were supposed to do, or do we need to reassess and come up with a new plan and implementation of that plan? The nursing vision, Sentara's mission to improve health every day, that really should be our goal, in creating an environment that's conducive to that. You know, it's normal for a patient to be uncomfortable and not quite at ease at the hospital, but the more that we can be there for them, give them that therapeutic relationship that they need from us, and just make them as comfortable as possible to share with us their needs, and share with us their fears, is just only going to improve their outcome in the long run. And when they are discharged, the goal is for them not to come straight back. They should be comfortable with the education that they received, and they should be comfortable with taking care of themselves in a positive way. So for my critique on this professional nursing practice model, I actually really like it. Orum's theory is one of my favorite theories. I think that it's just immeasurable, the benefit of a patient really learning about what's going on with them and, practicing self-care while they're in the hospital. So just being really involved in their care. That way when they leave, they're comfortable, especially with new diagnoses, things like diabetes, where they're going to have to be giving themselves insulin. I enjoy teaching them how to use insulin, how to give themselves shot, if there's a spouse or a family member that's going to be administering the shot, teaching them how to do it. Once they do it in the hospital, they're going to feel much better about doing it at home. If they're going to do it for the first time at home, nobody would like that. So this, professional practice model does a really good job at acting as a guide for us as far as just nursing care in general, looking at the bigger picture to make sure that we're taking care of the patient and their needs. And then just, including the whole team, because it's not just nurses. There's so much that goes into taking care of a patient at the hospital. Even the transport team, moving people from room to room, just making them feel as comfortable as possible, even though it's an uncomfortable situation, and that's just gonna improve their outcome. Alrighty, thank you for listening. Have a good day.